everybody. A very good evening to one and all. Dr. Rona Gandhi, and I am working as an assistant professor in the Department of Endocrinology at Dr. SN Medical College, Jodhpur, Rajasthan. Today, I'll be moderating a session on ESI FBI Live on the topic of screening and diagnosis. So, at the outset, I would like to thank the team ESI, especially Dr. Rakesh Sahay sir, for providing me an opportunity to moderate such an important session and making the people aware about such an important condition. I thank everyone who have joined in for this session. Endocrine Society of India has been conducting these FB live sessions on every Saturday, covering different aspects, different endocrine topics each month for the purpose of awareness among the general public. So, topic for this month is pre-diabetes, and today will be the first session of the series of 4 sessions that will be going to take place during the every Saturday of this month. And to join us in this awareness session, we have 3 eminent panelists with us. So let me introduce them. First panelist is Professor Dr. Rakesh Sahay sir. Sir is President, Endocrine Society of India and Professor and Head, Department of Endocrinology at Osmania Medical College, Hyderabad. I welcome you, sir.
Yeah, good evening.
Next, we have Professor Dr. Sushil Jindal sir. Jindal sir is Professor and Head at the Department of Endocrinology, People's Medical College, Bhopal, Madhya Pradesh. I welcome you, sir.
Okay, you can introduce other speaker or other panelists.
Third panelist, we have Dr. Sunil Kota sir. Sir is Consultant Endocrinologist at Diabetes and Endocare Clinic, Barampur, Odisha. So before we engage into the different aspects of screening and diagnosis regarding the pre-diabetes, I would humbly request Dr. Rakesh Sahay sir for his opening remarks about the pre-diabetes.
So, good evening to everybody who has joined today for this Facebook Live program, which we've been running from last several months. The Endocrine Society of India, as you all know, has been running this program and covering different aspects about endocrine disorders. And this month, we have decided to focus on pre-diabetes. Pre-diabetes is something which is very important, which is an important condition because it's a precursor of diabetes. We could say it's a precursor or a forerunner of diabetes, and it's a condition which can be preventable, and we can prevent diabetes if we are able to identify pre-diabetes. So that's the reason why we have focused this whole month's program. I mean, all the 4 Saturdays of this month would be focusing on pre-diabetes, what to do, and today we are discussing how to identify pre-diabetes, what are the implications of pre-diabetes. So we'll be discussing on a broader aspect of pre-diabetes, but subsequently we have actionable items discussed, like what should be the exercise to be followed, what is the dietary patterns to be followed. All these aspects will be coming up in the next 2 or 3 weeks. So over to Ronak to start the discussion.
Sure. Thank you very much, sir. So this session that we are going to start, we will take up this session in a question and answer format, where I'll be putting up the questions to our very seasoned panelists, and they will be giving us the answers, which will try to help us to elevate the anxiety and in the public awareness part. We can also have the questions from the viewers, which viewers can type into the comment section, and then we can take up those questions also, and the queries of the public will be also addressed during the session. So to begin with, I'll start with my first question. My first question to Dr. Jindal sir: what is pre-diabetes? What do we mean by pre-diabetes, and how do we identify this condition? How do we identify pre-diabetes?
Uh, Thank you, Ronak. Actually, when we see the different stages of development of diabetes, you can have a normal blood glucose level, and then you have certain cutoff limits to diagnose diabetes. So there is a transition between normal and the diabetes mellitus, and those people who fall in between these two normal and the cutoff limits of overt diabetes, they are put under the category of pre-diabetes. To be precise, if we see the fasting glucose level, that is any glucose level which is when the sample is taken after 8 hours of fasting, we see that in a healthy person, the blood glucose should remain less than 100. But the cutoff limit to diagnose or say that the person has developed diabetes is 126 or above. So there is a category of people who are in between 100 and 126, and these people are classified under the category of prediabetes when we look at the fasting glucose level. Another way to see the dysglycemia in a person is to challenge him with 75 grams of oral glucose after 8 hours of fasting. And then, if his blood glucose rises above 200, then we say that a person has developed diabetes. But a normal person will keep his glucose levels below 140 after 2 hours of a glucose challenge. So there is a distance between 140 and 200, and those people who fall in between these values, they are called as suffering from prediabetes. Another way to judge the glucose levels in the blood and make a diagnosis of diabetes is to see HbA1c, which is a sort of an average of 3 months glucose levels in the blood. And here again, a normal person has a HbA1c which should be below 5.7%. And to make a diagnosis of diabetes, it should be more than 6.5%. And those people who have a HbA1c value of between 5.7 and 6.5, they will be categorized under the category of prediabetes. Now, what is the importance of diagnosing prediabetes? Now, we know that those persons who are suffering or who are categorized under the prediabetes heading, they have a very, very high risk of developing diabetes in near future. And studies tell us that every year there is approximately 10% risk of these becoming diabetes. Another important factor is that these people are also running very high risk of developing some cardiovascular disease like heart attack or a stroke, and they also have some more complications, though it is to a lesser extent than the overt or full-blown diabetes. And another very good thing about diagnosing prediabetes is that this is a condition where, if proper intervention is done through lifestyle and sometimes through some medicines, that we can revert back it to the normal level, we can prevent diabetes, and we can postpone diabetes. And so this becomes very, very important for us to screen the people who probably are running the risk of developing diabetes and tell them that you can be prevented from developing diabetes. Over to Ronak, please.
Thank you, sir. Thank you very much for your lucid answer. Uh, now, now we have one more question for Dr. Sunil Kota, sir. Sir, there are other terms like impaired fasting glucose, impaired glucose tolerance. Are these terms synonymous with the term of pre-diabetes? And if it is not synonymous, then what are the differences between the pre-diabetes as diagnosed by HbA1c or which is diagnosed by IFG and IGT, sir?
Thank you so much, Ronak, for that wonderful question, and thanks to Endocrine Society of India, led by our revered president, Professor Rakesh Sahay, sir, for including me in this prestigious program. And after listening to Sushil Jindal, sir, I think I do not have much more to add, but I am certainly going to add few more statistical point why it is important. If you can recollect the acronym which was presented in the previous slide, the P stands for preventable, R stands for reversible, and E stands for by early detection. You can prevent and try to revert back. And if you look at the data, Indian data, it says that there is a national urban diabetes survey which says around 14% in people in India are having pre-diabetes. And if you look at American data, it takes us to probably somewhere around 30 to 33%. And compared to diabetics, where 50% people do not know that they have diabetes, pre-diabetes is one such entity where around 70 to 80% of the people do not know that they have this particular entity just because they do not come to the fore with any of these symptoms. And the blood glucose status of a particular individual can be known by three basic parameters. Susil sir has clearly told us one is fasting plasma glucose, second is 2 hours after 75 grams of anhydrous glucose intake, which is very much equivalent to 82.5 grams of the glucose which is available in the market. And also third parameter is the HbA1c, which is a marker of your sugar control over last 3 months. So now coming to your question, the IFG is defined as impaired fasting glucose, which is defined as fasting glucose between 100 to 125 milligram per deciliter. And the IGT, which is also known as impaired glucose tolerance test, 2 hours after the intake of 75 grams of anhydrous glucose or 82.5 grams of the glucose available in the market. If the value is between 140 to 200, we label it as impaired glucose tolerance or nicknamed as IGT. Also, we have another parameter, HbA1c. If it is between 5.7 to 6.4, then also the patients are labeled as having prediabetes. So prediabetes, there are three components: either it is a IFG, either it is a IGT, or A1C between 5.7 to 6.4. And very, very importantly, how do we diagnose and what is the ease of using these parameters? To look at the convenience angle, most of the experts, including our teachers, would like to tell us, would like to teach us that the fasting plasma glucose and the HbA1c are the ones which can be done without any hassle. So this is the sum and substance. They are all equal. So the components can be IFG, IGT, or HbA1c between 5.7 to 6.4%. Over to you, Ronak.
Thank you, sir. Thank you very much, sir. Rakesh Sahay, sir, can we see pre-diabetes and diabetes mellitus as two different conditions? How they are differing from each other? What is the difference between basically a pre-diabetes state and a diabetes mellitus, overt diabetes mellitus state as a state?
Rakesh, you are mute.
Sir, Rakesh sir, you are muted, sir. Sir.
Yeah, sorry, I was muted. So our panelists have actually brought out very important facts in the just now, that pre-diabetes is a situation. They've given us the definition of when you call it as pre-diabetes, exact numbers in terms of the fasting glucose values, the postprandial glucose values, and the HbA1c values, and we have quite learned audience also today. We have Muhammad Munir, who is asking us about CGM also. So and also about the ADA and WHO differences in terms of the cutoff values that are used by these. So we'll be discussing that further again. But but to put it in short, what I would say is that as we know that diabetes, we are worried about diabetes because we are worried about complications of diabetes. So pre-diabetes may be different in terms of some of the complications not happening in pre-diabetes, happening only in diabetes. That is the microvascular complications, which are very specific for diabetes, may happen only in diabetics. Pre-diabetes may not be having that much of it, but even there are studies which are showing that some of these complications like neuropathy and all that may start off even in pre-diabetes. Now the other thing that is very important is that to understand is that it is a continuum. It is not a difference. It is the same. I mean, the same person goes from pre-diabetes to diabetes. It's not that it's a different disease. It's the same process which is in evolution. And if you are able to identify it early, we are saying that if you are able to identify it early, you can prevent all the complications that happen. Other important thing is that the cardiovascular complications of diabetes, which you are very much scared of with diabetes, because that's the problem that happens very much in diabetes, that happens even with pre-diabetes, because that is not just because of diabetes, the cardiovascular disease, but it's because of many other components which are present even before diabetes develops. That is the blood pressure, lipid abnormalities, cholesterol abnormalities, the weight, of the individual, if he's overweight, all these are also contributing to the heart disease, and that can happen even with pre-diabetes, and people with pre-diabetes can develop heart disease. So that's how pre-diabetes and diabetes are in some ways different, some ways not different, but it is basically a continuum. And I think that answers some of the questions. And just to add to the other point that Muhammad Munir has highlighted, is that today we have gone into the era of CGMS. And so we may be identifying pre-diabetes by just looking at the amount of time that the person is going a little above 140, and that also can be used to identify pre-diabetes. He's spoken of a parameter called GMI. He says glucose maintenance indicator. So I think Sunil Kota may tell us something more about that.
Yeah, see the glucose maintenance indicators, of late we are seeing newer parameters coming into the picture, as Professor Rakesh Sahay sir was also alluding to. The first and foremost point is the TIR, the time in range, which talks about the percentage of time on a particular day the patient is able to spend the glucose in normoglycemia range, which is predefined somewhere between 70 to 180, or it is as per the user, because depending on the people we can actually alter the target, because we have a number of conditions where we can go a bit slow, and the percentage of time that the person is spending in that range is TIR, and the TIR has to be somewhere between 70 to 80%, and it generalized scale. But then if you talk about people having chronic kidney disease, type 1 diabetes, elderly, these parameters can keep on changing. But for diagnosis of pre-diabetes, I don't see any role of this particular parameter. Maybe our seniors can answer this.
Yeah, so I think it's just that there's also some more discussion about somebody eating sweets and having a little high sugars. Yeah, that can happen, but by and large what we see is a normal person, even if he eats a little sweets on one particular day, it should not go up beyond 140. If it is going up, it means that that person is going into pre-diabetes. And this is something which is easily reversible, easily correctable by changing your diet, and you need to understand that. And you need to make changes, appropriate changes, so as to prevent further progression towards diabetes.
Thank you, sir. Thank you very much, sir. So, Sunil Kota, sir, who are the patients that we should be going for the screening of pre-diabetes? Not every individual should be requiring a screening for pre-diabetes. What are the parameters that you look for that these patients or these people should be screened for pre-diabetes?
See, to answer this particular question, I would like to quote the United States Preventive Services Task Force recommendation, which tells us that between age of 35 to 70, if someone is having overweight or obesity, he should be subjected to a screening of pre-diabetes or diabetes. So when we actually try to screen for a disease, we need to have a certain symptoms or certain risk factors, and time and again we all know that symptoms or signs attributable to pre-diabetes are not that much well validated. But again, we know that there are subtle symptoms which can probably point towards presence of pre-diabetes, like darkening of skin, which is in medical language known as acanthosis nigricans in certain parts of body, like nape of neck, armpits and groin. Then the abdominal obesity, difficulty in losing weight. Skin tax is very common, lack of energy. But then we have certain risk factors for development of diabetes or pre-diabetes, as far as this particular topic is concerned. Whenever there is a strong family history of diabetes, whenever there is past history of gestational diabetes, if a particular person is overweight or obese, we have a parameter, the body mass index, which is calculated as weight in kg divided by height in meter square. If it is more than equal to 23, the person is labeled as overweight. More than equal to 25, the person is labeled as obese. And also there are waist size parameters for Indians. If a male waist is more than 90 centimeter or female waist is more than 80 centimeter, that also puts them at higher risk. People who lead a sedentary lifestyle, And the age factor is very important when we are talking about particular race and ethnicity. For Indians, probably the age should be 35, and what we learn from our seniors is that if someone is having multiple risk factors, the age can be brought down to 30, and someone is having high calorie diet, sweetened beverages, one is inactive, one who has polycystic ovarian syndrome, which is manifested in form of irregular menses and presence of male pattern hair growth, people with obstructive sleep apnea, tobacco smoke, as per some of these studies. And also, there are some additional risk factors for prediabetes. If someone is having high blood pressure, high level of triglyceride, which is one of the parameter of lipid profile, and also one who is having low level of high density lipoprotein, that is the HDL cholesterol. So if these risk factors are there, probably we need to screen them for presence of prediabetes. And we all understand, we all have learned from Sushil sir's presentation that what are the diagnostic cutoffs. Over to you, Ronald.
Thank you, sir. Thank you very much, sir. So, Sushil Jindal, sir. Sir, all the patients who are having a pre-diabetes, do they necessarily progress to diabetes over to diabetes mellitus, or there is a subfraction of them? And what can be the predictors? Can we predict that these will be the high-risk patients who will be progressing more often to the diabetes mellitus?
See, Ronak, what happens is that if we see the various research papers, uh, you can say that almost 10% of all people who are suffering from pre-diabetes will progress to diabetes every year. And there are data to suggest that if you take a cutoff of 5 years, almost one third of people suffering from prediabetes will become diabetic. And if you take cutoff of 10 years, nearly 70% develop diabetes. So the progression to diabetes is very, very steep. And the only good thing is that it is preventable. Then you asked about the various parameters. So if somebody in the range of say the pre-diabetes, if he has a higher level of glucose or higher level of HbA1c, he's more prone. If person is obese, is leading a sedentary lifestyle, he remains tense regarding his job or any mental stress, then they are again likely to develop. And if you have a strong family history, particularly in first degree relatives, that father, mother, or both of them, they are suffering from diabetes, then again the chances of developing diabetes are pretty strong. And then we usually say that diabetes do not come alone. It comes with these bhaivatijas, and these bhaivatijas are blood pressure, obesity, high cholesterol, and just now Dr. Sunil Kota told us so many things. And the girls who are suffering from polycystic ovarian syndrome, all these are more likely to develop, or those ladies who gave birth to large babies, or their birth weight of their babies was more than 3 kgs. Again, these are the people, or these are the ladies or men who are likely to develop progress to diabetes faster or earlier as compared to other people who are not having all these risk factors.
Thank you, sir. Thank you very much, sir. Sir, Rakesh Sahay, sir. Sir, as we have seen in our discussion too many times that pre-diabetes is a reversible, preventable condition. So, is this prevention or reversal is practically possible in the practical life? And if it is possible, then how it can be achieved, sir? Can a patient who is in pre-diabetes stage, can he go back to normal levels, sir?
Yeah, so I think that's a interesting question that we are trying to address. I mean, that's the whole point that we are trying to make by this program itself, is that pre-diabetes is a condition which is very much reversible, which is very much you can get back to normal with pre-diabetes. And as Dr. Sushil Jindal sir has just now said, that if you look at the progression rate to diabetes, classically, traditionally, several years back, we used to say one third of people who develop pre-diabetes will remain as it is, one third will become normal, one third will progress to diabetes. But that doesn't hold true anymore for our population. There have been studies in our population, that is in Indians, and we are saying that we almost zoom through pre-diabetes into diabetes. we very fast, very rapidly go from pre-diabetes to diabetes. Worldwide, if you look at the prevalence, all that, we say that okay, 10% are becoming diabetic every year, and by, as sir said, that after 10 years, almost 70% become diabetic. So, but in our country, what we have been seeing recently of late is that people are becoming diabetic very fast, and they are not remaining pre-diabetic for very long time. So that's the reason why we are holding this program. That's why we are trying to focus on pre-diabetes, to say that it is a reversible, very much reversible, very much preventable problem, where we are, our focus is to prevent diabetes become normal, and that can be done by lifestyle measures. That's the major thing that can bring about a change. And in fact, Mohammad Munir is asking whether pre-diabetes is it synonymous with metabolic syndrome. I would not say that pre-diabetes is synonymous with metabolic syndrome, but metabolic syndrome is a common accompaniment of pre-diabetes. That is, metabolic syndrome means all the things that Dr. Sunil Kota has just now spoken about, Dr. Sushil Jindal has spoken about, that the presence of obesity, presence of blood pressure, presence of lipid abnormalities, all these together are called as metabolic syndrome. And people may not have diabetes or pre-diabetes to be part of metabolic syndrome. They can have metabolic syndrome even without being pre-diabetic. But pre-diabetics generally have metabolic syndrome, other components of the metabolic syndrome. So pre-diabetics generally have other components of metabolic syndrome. All metabolic syndrome may not become pre-diabetic, and so it's important that we address all of them. And important thing is to bring down the weight, come down to normal weight, and become physically active, and adopt a healthy life, healthy diet, to reverse diabetes and reverse pre-diabetes. And more so because now we have data from studies which have been conducted by very elegant studies, which have shown that even diabetes can be reversed, at least in the early stages, that is within the first few years of detection. If people take action, they can reverse diabetes also. So pre-diabetes obviously can be reversed, and we should all focus on identifying pre-diabetes so that we can reverse it.
So we should be overall be very vigilant about the development of the pre-diabetes, and in the early stages of type 2 diabetes mellitus, even we can resume back to the pre-diabetes and the normal state of the normal homeostasis, where the diabetes no longer exists. That can be achieved. So, what, Sir Sunil Kota, sir, why should we be aware of this pre-diabetes? Why should we be aware, and how will you counsel the patients who come to you with pre-diabetes, about who is very anxious about the clinical implications, the complications that he may have because of pre-diabetes? How do you do this kind of things, sir?
See, it has been a common practice on our part to tell each one of our patient to not only look at the sugars, because it is not only the sugars which worry us, it is also about managing the and preventing the complications. So we have a different level of prevention of complications, and management of pre-diabetes and trying to reverse it, as Rakesh Sahay sir was alluding to, is very, very important. Because you see, uh, Rakesh sir has already told us there are some classical complications of diabetes which occur only after there is a frank onset of hyperglycemia. But these are called microvascular complications, or the ones which involve vessels of smaller diameter. There are also macrovascular complications which involve larger vessels, and the seed for these complications start much before the diagnosis of prediabetes or diabetes, which is known as the common soil hypothesis. And we all know, as Sushil sir was initially introducing the topic, he also told us that prediabetes is linked with long-term damage to your heart, your blood vessel, your kidneys. So if you can actually halt it at this stage, and if you can revert it back to normoglycemia, you can lead a life where there would not be any medicines. Not only that, we also can prevent these complications. Also, we know that once you are not controlling it at this stage, once you go on to over type 2 diabetes, we know what all complications we can get into. And also, Sushil sir was clearly telling us that diabetes can give rise to hypertension, cholesterol. These are interlinked. We are also taught during our training days that hypertension can also give rise to the other parameters like hyperdysglycemia or hyperglycemia. So it is all about management of lifestyle, wherein we can control all these three parameters well, and therefore the complications prevention can be started at a primordial stage just by lifestyle modification also.
Thank you, sir. Thank you, sir. So, Sushil Jindal, sir, the link between the pre-diabetes and the cardiovascular diseases that we have heard much about, that the cardiovascular disease and pre-diabetes are linked together. What are your thoughts about it, sir? What you think that why they are so much linked, and what can be done to reduce these kind of issues during the pre-diabetes stage, even, sir?
See, if you see the various risk factors for development of pre-diabetes or diabetes and development of, say, in the layman's term, heart attack or a stroke, is that you have a higher glucose level, if you have a high blood pressure, if you have high cholesterol, and then if you have obesity. So all these things, they are being shared by both the things, that is diabetes as well as the cardiovascular diseases. So we can, and then there is another possibility that these things may be genetically also linked. If you are prone to develop one problem, then you are all simultaneously also prone to develop. And this is what Dr. Kota was alluding, that there is a common soil hypothesis. That is, if you have all these risk factors together, then there is all the chances that the seeds of both cardiovascular disease as well as dysglycemia or deranged glucose levels will come in the same individual. So we can say that because the risk factors are almost overlapping each other, and then we can also have some genetic links that both the diseases may have some sort of common soil for production of these diseases. So this is how they are linked together, and so it becomes very important that not only glucose being controlled. If patient has deranged cholesterol levels, he should be given proper medication to control the cholesterol. If he is obese, we should recommend that he should lose weight. There should be some very good intervention regarding diet also, that is his glucose levels are not further increased, weight is not further increased, and anything which can add to hypertension or deranged cholesterol should also be avoided. And this is how we can prevent cardiovascular diseases right at the time of pre-diabetes. And we know that once patient goes into full-blown diabetes, then these complications they are likely to develop at almost at double or triple rate as compared to pre-diabetes. Though pre-diabetes itself is a risk factor, and many people with pre-diabetes will develop before they develop diabetes, they may develop heart attack, they may develop a stroke, or they may develop some other complication of diabetes. So we can say that not only lifestyle, but sometimes some pharmacological agents to control hypertension, to control the cholesterols, and also the lifestyle changes regarding weight management and exercise, they will prevent not only development of diabetes, but also development of the cardiovascular diseases like heart attack.
Thank you, sir. Sunil, sir, as you have mentioned, so Jindal sir has already mentioned about the pharmacotherapy and everything in the pre-diabetes stage even. Sir, Sunil sir, is there any role for bariatric surgery in the patients who are having pre-diabetes, sir? What are your
See,
comments, sir? You have done a work on bariatric surgery, sir.
yes, actually, it was under the guidance of Rakesh Sahay sir also, where I did my residency in endocrinology also. We had a metabolic surgery. We used to call that metabolic surgery those days, and it was raking a lot of nerves also. But I can definitely say, if you look at the international recommendations for bariatric surgery, it is generally reserved for people having body mass index more than equal to 40 or more than equal to 35 with one or more obesity related comorbidities, which includes type 2 diabetes, hypertension, sleep apnea, respiratory disorders, non-alcoholic fatty liver disease, lipid abnormalities, and few others. But when it comes to Indians, we know that the onset of disease is bit early, and we are also having the youth day on 12th of August, and we Indians tend to develop all these metabolic ailments at least a decade earlier than our Western counterparts. and also at a far lesser weight. Therefore, the Obesity and Metabolic Society of India, which is OSSI, that guides us to go for bariatric surgery.
I think Dr. Sunil Kota has a
Hello.
problem with his audio. His link is not very clear, but essentially what he was trying to tell us is that that
To talk
bariatric
about,
surgery. Yeah, okay, he's back. Yeah, please go on.
Sure.
We lost your
yes,
voice.
so,
Yeah,
oh, sorry for that. So
so you
there
can
are
just
no.
summarize what you said. Yeah, because we missed some part of it.
Yes, so summaries the recommendation for bariatric surgery for people having pre-diabetes would be for India if the BMI is more than 32.5 kg per meter square. So that would be my summary of what I've been saying.
Sir, thank you, sir. Thank you, sir. Sir, Rakesh, sir, fasting as festive seasons are coming up, Navratra and the holy month of Ramadan and everything. So, how is fasting can be done? Can we do the patients who are having pre-diabetes? Can they fast? Can and if they want to fast, how they should manage matlab, with the pre-diabetes? How should they should be advised about the pre-diabetes and fasting?
Yeah, so I think what I mean, fasting is very good for anybody. Fasting is, that's why, all our religious traditions say that you should. I mean, fasting is advised. That's because fasting is good, and it has been shown that fasting is. We are speaking about fasting in pre-diabetes. We are not speaking about diabetes. Diabetes, what
Yes,
happens
sir.
is that you're
Yes, sir.
taking medications. These people are on medication, so we have to see how to adjust the medications and how to see that they don't have problems with the medication that they're taking, the insulin that they may be taking. So this is not the scenario that we are speaking about. Now what we are speaking about is a person who has got pre-diabetes, who doesn't have any problem, who is not on any diabetes medication. So there, fasting is actually beneficial for him, because we have a lot of data, as Munir, again Mohammad Munir has also
Yes, sir.
very rightly said. He has spoken about the DPP study, and DPP study, the Finnish study, all these studies have shown that people with pre-diabetes, the best form of treatment is to adopt a healthy lifestyle, eat less, and walk for about 150 minutes per week. And if they lose weight, lose about 7% of their weight, they were able to
Yes, sir.
prevent progression by about 50%, and that worked better than any of the medicines. So fasting is very good for people with pre-diabetes. And what we are trying to say is that whether you are fasting, I mean, there are different ways of fasting also. People say nowadays we have different ways of fasting which have been very scientifically studied. There's something called as intermittent fasting. We say that people should, not eat for say 12 or 16 hours, don't eat only for 8 hours. That's what traditionally many of the religious beliefs also said. Eat for some time of the day, don't eat for other time. So that's how, what that is probably brought out in this intermittent fasting, which has been extensively studied. And what has been shown in that is that it reduces I mean improves the metabolism in many ways. Improves the so through all those, what it has been shown is that intermittent fasting is very good. So pre-diabetics certainly should be able to fast. There's no problem with that. They are not on any diabetic medications. They may be on antihypertensives, they may be on lipid lowering medications, which can be continued as it is. They are medicines which has to be taken in a timely fashion without requirement of adjustment with the meal and all that. So that is about the fasting aspect of it. And just to summarize that, what I would say is that, if you look at the continuum of because there's one question about metabolic syndrome and all that. A lot of people have been asking about metabolic syndrome. So what I would like to say is that, and Dr. Sunil Kota has also put it in a different way. What I'm trying to say is that, this whole thing about is a continuum where a person starts gaining weight, and because he's gaining weight, what happens is that there is some amount of insulin resistance developing in the body. That means that the insulin that is being produced is not working enough. So more insulin is being produced, and the person is normal. But that more insulin that is produced may keep the glucose normal, but it is bringing up the blood pressure, causing the blood pressure to go up, causing the lipids to become abnormal, and causing atherosclerosis, means deposition of this fat in the blood vessels. And all this is what is metabolic syndrome. So somebody may not have diabetes, but he has metabolic syndrome right from the beginning, and that is that common soil is that insulin resistance, which is come because of, most of the time, because of weight and the excess calories that we are taking in and without exercise. So that is the major problem. and that manifests later on with pre-diabetes, and this progresses to diabetes. So what we are saying is that pre-diabetes, by knowing about pre-diabetes, by screening for pre-diabetes, we are identifying people early, these problems early, and we are able to see that the person doesn't go on to developing full blown doesn't go on to develop diabetes and all its problems. He should catch him in between itself and see that we can bring them back to normal. That is the main message that we want to see. And there was one question about whether we should do 150 minutes of exercise versus 300 minutes of exercise. So what we are saying is that 150 minutes worldwide, what everybody is saying, and but in our own Indian studies we have seen that that much of exercise or that and only lifestyle measures have not worked very well, because we, as Dr. Sunil Kota said, that at lower levels of BMI, lower levels of at lower levels of BMI also we are at higher risk of diabetes and cardiovascular disease. So we need to do more. And some studies, as rightly pointed out by Mohammad Munir again, he has said that 300 minutes is probably better. Yes, that is probably better, but 150 minutes was the minimum that people showed across the world. They showed that 150 minutes is good enough to bring about some difference. But if you do 300 minutes, that's even better.
Actually, there is one more question from Sri Mohammad Munir, that there is a difference between the cutoffs suggested by WHO and ADA for diagnosis of IFG. With your
Yeah,
permission, I would like to answer that.
yeah,
Actually,
please,
there
please.
was a paper on elderly Koreans, which was somewhere around 2002 or 3, which concluded that probably the WHO is better placed to diagnose diabetes if you handpick elderly Koreans. But then there is a recent study in 2021 which was trying to screen the young Polish people from Poland, and they said in them ADA is better placed to pick up diabetes. So probably because we are talking about young onset of diabetes in India, that's why the Endocrine Society of India and the RSSDI guideline, the combined guideline, also told us that the cutoff should be 100. So probably this is one such study based on which the 100 is the one which we are picking up.
Yeah, so I think Dr. Sunil has put it very nicely that we are worried about early onset of diabetes and all that. In older people, if they have between 100 to 110, we may not worry so much, because what happens is that they will not progress very rapidly. They are not going to change their lifestyle so much. They're already reached a stage in their life when they're not going to eat more or reduce their physical activity. So they may not they may not have much of a difference if you don't pick up leave those between 100 to 110. But younger people between 100 to 110 are the ones who are at risk of progressing to diabetes. So I think it's better that we take the 100 as a cutoff, 100 as the cutoff for normalcy versus pre-diabetes. And another question which Mohammad Munir has again asked is about type 1 diabetes and pre-diabetes. Type 1 diabetes, is there a pre-diabetes stage? Yes, technically there is a pre-diabetes stage even in type 1 diabetes, because but the whole thing is it's a different ball game. It's not about lifestyle, it is about autoimmunity, and so there you have to use medicines and all that. So that is not what we are discussing today. That is a little totally different thing which we are not discussing that today. We are discussing about type 2 diabetes, pre-diabetes, which is preceding type 2 diabetes, because that is what is in our hands. That is not the type 1 diabetes. The pre-diabetes preceding type 1 diabetes is not in everybody's hands. It is and it requires medication. So that's not what we are discussing today. We are discussing about the pre-diabetes which precedes type 2 diabetes.
Type 2
So
diabetes.
that is very much in everybody's hands. I mean, it is the person himself can decide whether he goes forward to diabetes or goes back to normalcy. That is in the person's hands. So that is what we are trying to say, that we are trying to empower everybody with the information that you have the ability to decide whether you go towards diabetes or become normal.
So may I request Rakesh Sahay sir to inform all of us about the pre-diabetes day that is being planned by Endocrine Society of India. Please
Yeah.
inform all
So
of us, sir.
yeah, so I think I take pleasure in informing all of you that the Endocrine Society of India initiated this special this thing to call for August 14th as pre-diabetes day, basically with the idea that we need to act immediately, act now to prevent diabetes. So that is the theme this year, and every year we have decided to have 14th August as pre-diabetes day to increase the awareness about pre-diabetes, as we have been discussing all along in this program about pre-diabetes, and I'm sure all the viewers have understood the importance of pre-diabetes. And to spread this awareness across the country, we have made August 14th as the pre-diabetes day, and we are planning out many activities amongst not only amongst the general public, amongst the physicians, diabetologists, amongst the general practitioners, amongst the doctors, all of them, to make them more make them aware about this, and so that they can in turn spread this information to their patients, and to see that diabetes can be prevented amongst our population, because we have a huge burden of diabetes. We have a very large number of people with diabetes, probably only next to China, and going by the way we are going, we may even overtake China in the next few years. So to prevent that, we need to act now to prevent diabetes. So the theme
Act,
this year is
sir,
act now to prevent diabetes,
act now.
to beat
Sir.
diabetes rather.
So the August month is our month of pre-diabetes. 14th August is the day or the pre-diabetes day, and the 14th November will be the diabetes day. Sir, I have another aspect. I have another thing that as we are seeing that in younger populations, we are considering that Indians are at more risk of developing pre-diabetes. Indians are at more risk of developing diabetes. So, how to screen the patients with adolescent patients who are having risk factors? Mother, father are diabetic, or elder siblings are diabetic. Sir, can you throw some light, Sushil sir, about this? That how to screen these adolescent people or a younger population for pre-diabetes?
Yes, Ronak, I think you have very correctly said that with the changing lifestyle in the children, we see them going to school, coming back, going to coaching classes, and then sticking to some video games or even sitting against the screen of televisions, and hardly any games periods in school or any cycling or anything they take up there. They have good cars and they have school buses to pick them up right from their doorsteps. So what is happening is the children are also getting obese, and so this is the reason we are seeing more and more children becoming type 2 diabetic. And so definitely the precursor will be type 1 diabetes, and probably if we pick them up at that stage and properly educate them, properly train them that there is a need to change your lifestyle, we can definitely prevent possibility of developing diabetes at a younger age. And for that, I think we should pick up, we cannot screen all people, so we should pick up people who are more likely to be positive for pre-diabetes. So I'll say that if the parents are diabetic or if the grandparents are diabetic, then this is one particular category. Second is that if a child is gaining weight and he has become obese, then again I'll say that we should screen. And we also know that there are certain parameters for insulin resistance, the central obesity. If there's a saying in Hindi that if tond is becoming matka, then dil ko lage jhatka. So we should definitely try to see that if somebody is growing his central obesity, these people must be screened for possibility of diabetes, pre-diabetes. And similarly, if there are girls with polycystic ovarian syndrome, these also are likely to have dysregulation of glucose very early. So they should also be screened. So I think these are various categories where we should give more emphasis on screening. Maybe that we can have some programs in school and pick up these type of children and ask them to go for a fasting glucose or HbA1c, or if possible a glucose challenge test, or we can advise their parents that they should take up such investigation, so that we come to the very early warning stage that yes, you need to change their lifestyle. And all these junk foods and frequently going for restaurant eating and all those things are adding up to the childhood obesity. And when the childhood obesity incidence increases, is definitely more number of children will become pre-diabetes, and more number of people will in very early age will develop diabetes.
Sir, sir, sir. Sir, even the patient, even the adults, the age of onset of pre-diabetes, and the papers are coming up and the guidelines are coming up that in Indians there should be the age or should be relaxed to 25 years of age, after which we should be screening for the patients who are having the risk factors, as the Rakesh Sahay sir you and have elucidated that these risk factors, high risk factors, if there, then we should screen the patients from the age of 25 even, the adult patients, and the puberty, if the patient is having high risk factors, having a family history of risk factors of diabetes, then we should screen from the puberty in children and adolescent. So
I
one
was
question
reading a
is there,
paper.
sir. Sir,
Yes,
sir, please.
I was reading a paper that in US almost in the adolescent age group, 15% people with children, they are actually coming up with pre-diabetes, very high rate. So we do not have studies like that in India, but definitely we must not be lagging behind.
Sir. Sir, one more question is there, sir, from Shikha. How to keep follow-ups with patient with pre-diabetes, sir? How, Sunil Kota, sir, how do you follow up your patients with pre-diabetes? If a patient is diagnosed, adult patient is diagnosed with pre-diabetes, how do you do the follow-ups?
See, actually, I don't think there are any clear-cut guidelines to suggest how often do we need to follow patients having pre-diabetes, but it always probably is individualized, and most of the times we focus on the patterns which we generally follow for a patient having obesity or overweight. And if the values are good enough, and if you look at the RSSD ESI guideline also, if the person is not able to lose weight by 5 to 10%, if is not able to adhere to the lifestyle modification, and if it is not reverting back, then the guideline tells us that metformin 500 milligram twice daily is the only approved medication as per the Indian Diabetes and the Endocrine Society combination is concerned. And follow-up is generally very much equal to the patients who are presenting us with obesity. If there is a dysglycemia, probably it requires a bit more frequent follow-ups.
Thank you, sir. Thank you, sir. So similarly, sir, Rakesh, I said there is one more question. Then, when should we consider to start medication in pre-diabetes? And as Sunil Kota sir has already proved that, said that approved medication only metformin has been approved for pre-diabetes. Sir, when should we think of starting medications in diabetes, pre-diabetes stage rather than in diabetes? Sir, Rakesh, sir, you muted, sir.
Yeah, most of the studies have shown us that pre-diabetes is very much responsive to lifestyle changes, and lifestyle changes are much better than medication. But there may be some people who may not be able to adopt these lifestyle changes. They may either because of their occupation or because of other considerations, because of other problems that they may be having. They may not be able to indulge in physical activity. They may not be able to follow the dietary patterns or whatever it is. So in such situations we may certainly initiate medication. And also I think more of it is thought that in at older people may benefit more from medications, particularly if they have coexisting hypertension, dyslipidemia and all that. Then they may benefit from medication. But younger people without other comorbidities, I think should be we should be focusing more on lifestyle management in those people rather than medications.
Sir, Jindal sir, one question is there in the chat box, sir. The patients in Indian, we have a tendency that whenever some disease or some preclinical state is diagnosed, we try to blame it onto the environmental factors. Like we had sweets in the recent function or somewhere, that's why glucose have spiked up. These kind of presentation, these kind of things are seen very commonly in the practice. So one person is asking that how to convince these kind of patients, because most of the times when sugars or glucose levels are checked in these patients, they come up to be in the pre-diabetes stage, and the patient tries to blame it onto the having excess sweets or going to a function. So how can we counsel these patients? How to investigate these patients further?
I think this is human nature. That is, there is a phase of denial in any disease. ये मेरे को कैसे हो सकती है? So this is what happens, that they find some sort of excuse that because they have gone to some party or in last 2 3 days, or they had been taking a lot of sweets, and this is why their glucose levels have come abnormal. And then next step is that they may they may they themselves may start following a sort of avoiding sugars and following a diet, and then they will come up with another report which is better than the first one, and they'll say, see, I was telling you that this may be because of that. So this is very very common, but we should definitely tell them that even with one incidence of taking sweets, if your sugars are crossing the normal limits, there's every chance that you will be developing diabetes in near future or pre-diabetes in near future. This is not happening in isolation. This may be happening several times, and this definitely, this level of glucose level is putting a burden on your beta cells, and these beta cells which are producing insulin may ultimately tire down, and they may even go into death, and so you will be producing less insulin, and ultimately you may come up with pre-diabetes. So this is how we try to convince them. And if they have some family history positive, then it becomes easier. See, your father also had diabetes, so you have inherited genes for diabetes, and you definitely, we agree to that, you, this may be some degree may be increased because of your taking sweets last night in a party, but we can get it repeated after some time, and next time if you go for a glucose challenge test, that will definitely demarcate them from the normal. So I think this is how you can convince these people.
And another point is that this same information can be used to convince the people that, see, so much is in your hands. I mean, by making a change in his diet, he is able to bring it down from whatever level to whatever level. I mean, is there. So that itself can be explained to the patient, that we can use that to explain to the person that this is all within. I mean, within your control, and your diet and your exercise is making so much of difference. So the medicine is not required as long as you are able to do this yourself. So that's what I try to convince my patients, that this is what can be done by diet, and this is what you have shown by changing your diet itself.
Sir, one more question is there in our chat box, sir. Which type of exercise is recommended for reversal? Utpala has asked about the exercise that we can recommend for reversal of pre-diabetes stage.
So generally we speak about aerobic exercises, that is exercises like walking, swimming, running, or any of these exercises for about 30 minutes per day is what we speak of. But what has also been shown is that the resistance exercises, where you do a little bit of weight lifting and weight training and all that, those are also good. In some they also have certain advantages. They build up the muscle mass and reduce the insulin resistance, so they are also very good. So they can be done for about 15-20 minutes on at least 2 times in a week, while you do the more of the aerobic exercise, that is the walking, swimming, running, any such activity that you're doing. That is good. But in addition, if you do a little bit of weight training for about 15 minutes every two at least 2 times in a week, that may be good to give you the benefit.
Sir, so Sunil sir, if I ask you for a concluding remark about the pre-diabetes, what would be your 2 cents take-home message for the part there we can, what about the pre-diabetes has to be remembered?
Yes, again, I would reiterate, P stands for preventable, R stands for reversible, E stands for early detection. So it is a window of opportunity wherein you can get yourself back to normalcy, and you can also halt the progression to over diabetes by adhering to simple lifestyle, including diet and physical exercise.
Sir, sir, Sushil Jindal sir, what would be your take-home message or the concluding remarks, sir, for the pre-diabetes, sir, for our audience, sir?
I'll tell that pre-diabetes is a sort of prevent diabetes, and not only prevent diabetes but also the cardiovascular diseases like heart attack and stroke. And this is a warning for you that you can definitely do something to prevent marching into diabetes, and also prevent development of certain more serious and sinister diseases like heart attack. And nothing much is to be done. You to just follow some exercise program, and follow some diet planning and avoid certain sort of foods like very fried foods and a lot of oily foods, calorie dense foods, and also the carbohydrates should be avoided. Take a lot of veggies and a lot of fruits, and also and I'll say that if somebody is more than 60 years, best exercise is walking. And if he is fit, and he can also do some more exercises, and at least twice a week, some resistance exercises will also be good.
Sir, thank you, sir. Sir, Rakesh Sai, sir, what would be your token message, sir?
Yeah, so I would like to convey all those who are here and who are listening to this program, check your blood glucose levels and your HbA1c. If you have pre-diabetes, act now to beat diabetes.
Sir.
Don't think much, just get your blood sugar tested. That's it.
So, overall, from this session that I could have gathered out is the pre-diabetes is a condition that is predisposing to the diabetes mellitus and some few of its complications. So we have to look for it. We have to act now. We have to act fast. We have to beat pre-diabetes. We have to beat diabetes mellitus and its complications, which are we are fearing of. So we have to check blood sugars and act as soon as possible to revert back with minimal measures of lifestyle changes and exercise so as we can get back to our normal state. So thank you very much, Professor Dr. Rakesh Sahay sir, Dr. Sunil Kota sir, and Dr. Sushil Jindal sir for engaging with me, engaging with our audience about the questions that they have put up in the chat box about the pre-diabetes, and we have enlightened us to a very much extent. Thank you very much, sir.
Thank you. Thank you.
Thank you, sir.